Thank you for the invitation. The focus of this presentation is going to be around the nearly 2,000 wounded patients who received treatment at the MSF clinics in Gaza between April and September 2018. So the situation in Gaza is well known for most of us, starting from the end of March 2018. Regular protest of civilians in Gaza along the border triggered confrontation and a strong reaction of the Israeli army that resulted in more than 200 deaths and more than 22,000 people injuries between end of March and beginning of October 2018. In this period, more than 5,000 were the live ammunition gunshots wounds. MSF, and for clarity in this presentation, I only used the data of the activities of MSF France, provided post-hospital care in 4 clinics and non-emergency surgical care in 2 hospitals. So, due to the huge sudden influx of a new type of patients and the lack of flexibility of the data collection system that was used at that time, it was not possible to have a full picture of the medical needs of this new cohort of patients. Therefore, we carried out a very simple, classic retrospective study where we included, all patients who received treatment at MSF clinics because of violent trauma, mainly gunshots, between April and September 2018. We extracted the data directly from patients' files or clinic registers. I think we need to go back to by one slide. In this period, we enroll 1,957 patients. 98% of them were males with an age average of 25 years. 99% of them were treated because of wounds caused by gunshots. And it's not on this slide, it's on the previous slide. There was a nice graph that the cohort size increased quickly between mid-April and mid-June, and then started from mid-June, starting decreasing very slowly but constant. So 54% of the patients, including the cohort, had an open fracture. That was in nearly 40% of them described as comminuted. 91% of the fractures were located in the lower limbs. The cohort included also 844 patients with soft tissue injuries, 235 patients with vascular injuries, 181 with nerve injuries, and 65 patients with an amputation. So all the patients before enrollment in MSF clinics receive emergency care in other health facilities. We have the information that nearly 70% of them had been also hospitalized for a median time of 5 days, 4 days in April, and nearly 60% of them receive also surgical care, in particular fixation, mostly external, debridement, and vascular surgery. The median time between the date of trauma and enrollment in MSF clinics was 10 days. During the follow-up in the clinics, 262 patients receive surgical care from MSF surgical teams that perform overall 900 surgical procedures, mainly debridement, dressings in operating theater, and skin graft. During the period, more than 13,000 physiotherapy rehabilitation sections and more than 24,000 dressings had been performed. And in regards to the dressings, 7,200 for 2,000 dressing patients reported moderate or severe pain, and overall 3,700 of the dressings were medicated with painkiller. Thank you. So by the end of September, when we closed the study, 1,206 patients had already ended their follow-up, and nearly 40% of them were defaulters. Among the defaulters, around 20% drop out after the first visit, and overall 36% within the first week. The median time of the follow-up of the patient with fracture that had already been discharged at the end of the September was 47 days, 103 for the people who were still in follow-up at that time. So, in conclusion, this study's data show a pretty high number, a huge cohort of young male patients with complicated gunshot wounds who receive intensive care at MSF clinics. And for their characteristics, these wounds are at high risk of complication, long-term sequelae, and also disabilities. And probably a large part of the patients will need a long-term follow-up. The data showed also the need for strengthening the pain management activities in the clinics, things that has been done, and the need for shortening also the time between the hospital discharge and enrollment in MSF clinics. So finally, the data shows also the need for intensification of the health education activities, especially targeting the newcomers in order to reduce the proportion of defaulters. And with this slide, I finish. I would like to thank all the people that are mentioned in this slide. Without their contribution, the study wouldn't have been possible. Thanks so much.